everyone. I am Dr. Rashma Mohammed. I am a consultant neurologist practicing in Trivandrum at Sri Ramakrishna Charitable Hospital and SP Welfort Hospital at Shastamangalam, Trivandrum. I have done my MBBS from Madurai Medical College, MD from Google Medical College, and DM Neurology from MES Medical College. Today, we will discuss whether is epilepsy curable. What are the treatment options? Can one lead a normal life with epilepsy? When we talk about cure in epilepsy, what we typically speak about is the control of seizures, which in most cases is achieved with medications. Then there are cases where we can get complete cure with epilepsy surgery. Epilepsy surgery works in some cases, and we have to carefully select that population of patients who can be taken up for epilepsy surgery. When someone is seizure free for 10 years and off seizure medications for 5 years, their epilepsy can be considered resolved. A person who has an age dependent epilepsy syndrome but who is not having any seizures now and who has crossed that particular age can also be considered seizure free. Coming to the treatment options, first line is medications. These are anti seizure medications or anti epileptic drugs. More than a dozen drugs are available, and which medication suits you will be decided by your doctor based on the type of seizure you are having, based on whether it is a generalized tonic-clonic seizure or it is a partial seizure or whether it is a absent seizure based on the history and based on what happens during the seizure and based on other factors, whether you are a female, whether you are childbearing age, and whether other medications you are taking. All these will determine which medication you have to take. When you are prescribed one medication, they will select one medication which will be selected, which will be specific for you, and they will be adjusting your dose based on your weight, based on your duration of symptoms, and it will be titrated accordingly. Up to 70% of people with epilepsy have their seizures controlled with anti epileptic medications. Coming to surgery, epileptic surgery can be considered when seizures are not controlled with medication. The aim of the surgery is to stop or reduce seizures when the seizures do not respond to anti seizure medications. Seizures are disabling and impacting the quality of life. And importantly, a surgical focus can be identified, and that surgical focus can be safely removed. A safely removed focus means one that doesn't cause problems with in the areas that affect the eloquent areas, that are the areas that can affect speech or walking. Then there are other modalities other than surgery and medications, like vagal nerve stimulation. Vagus nerve stimulation therapy is a form of treatment for people with seizures who are not controlled with medication, or they may have failed surgery, or they do not want surgery. The aim of vagal nerve therapy surgery is to reduce the number of seizures as well as shorten and for the patient to have less severe seizures. It can be used together with medication. It is a device powered by a battery and it is placed under the skin of the chest wall. Usually, it is placed on the left side and there will be a wire attached to the left vagus nerve. The stimulation of the vagus nerve can reduce the frequency and intensity in some patients with seizures. This has to be specified for each patient. Then another therapy that can be tried is ketogenic diet therapy. And this is not one diet that you follow simply. You have to take your doctor's advice. It is an extremely low carbohydrate, high fat diet. It is used to treat epilepsy. Nowadays, some people are using it as some diet mechanism also. This was initially identified or discovered for treatment of epilepsy in children who do not respond to normal treatment. This diet is specially designed to force your body to go into ketosis. That is, it will burn fat instead of sugar for energy. So, this will produce ketones, which give the diet its keto name. It needs to be supervised by a neurologist and a dietitian and integrated into a medical treatment plan. It is advisable that initially the patient comes to the hospital or comes to the clinic and gets everything monitored and then start the diet. And it can be done along with existing epilepsy medications with proper adjustment of the dose. It requires detailed assessment to ensure that there are no underlying conditions that would make this ketogenic trial dangerous to the patient. Now, coming to the question, can someone with epilepsy lead a normal life? Yes, most people with epilepsy can live a full and active life, working, playing sports, socializing, traveling, and taking up hobbies. We advise them to avoid contact sports, to avoid sleep deprivation, as these can provoke a seizure, but otherwise, the patient can have a very active lifestyle. If seizures continue, some changes in lifestyles may be needed for safety reason, but it is still important to keep up as normal a lifestyle as possible. If we take necessary precautions, take the necessary medications, follow the doctor's advices correctly, we can have a healthy and active social life and as normal a life as possible. Thank you all for your patient listening.